What's up, Bootcampers? Hope you guys are having a fantastic day. Welcome to today's presentation in the interview hot seat with DT Bootcamp. My name is Alex. I'll be your host for today. In this presentation, we're going to go over interview questions. We're going to go over ethical scenarios. We're going to go over MMI scenarios. We're going to make sure that you guys are feeling very comfortable when you're at the interview seat. Let's get into it. So firstly, let's go over our objective. In this presentation, we want to learn the interview strategies. We also want to understand the reasoning behind each type of question. This is going to more certainly pertain for the traditional questions. However, it is also important to understand ethical dilemmas and MMI scenarios and how to go about answering them. We also want to begin preparing a question bank. So before we get right to the questions, I want to go over a few helpful tips that I can give you. So firstly, what you want to do is you want to call the school and ask for their interview format. Schools have different formats, so they have traditional style interviews, they have panel interviews, they have MMI interviews, so it's important to understand what you're getting yourself into. And you can also get some useful tips by talking to current students. Also remember to take your time. You don't have to answer the question right away. When the interviewer asks you something, it's okay to ask them for a few seconds to gather your thoughts. Next, you want to prepare a question bank. This is essentially how you are going to be preparing for your interviews. And that goes hand in hand with saying you got to do a lot of mock interviews. So invite your friends over, get your family to sort of ask you questions from your question bank and see how well you do. Also, don't forget to smile. I know the interview process can be sort of very nerve-wracking for you, and there's going to be a lot of anxiety throughout the entire day. However, do keep in mind that you should smile when you see your interviewer. And lastly, demonstrate interest. If this is your top choice, make sure you demonstrate that. Show them your enthusiasm about the program. They're going to really like this, especially if you do it genuinely. So, the first question I have is, why our school? Now, this question is going to pretty much appear in all of your interviews. It's probably the most common question. So what I like to do is I like to follow the rule of threes. When you get invited to an interview about a school, know the three things that you really like about the school and why you want to go to that particular school. You can get that sort of information from visiting the school's website, checking their social media platforms, reading their journals. That's going to be an awesome one. Or the newsletters. A lot of schools release either weekly or monthly newsletters, and it's important to read those. It can give you some very valuable information that you could use in your interview, and it's going to make you look very savvy. Also, you could talk to current students. Reach out to them either through the Facebook pages or through SDN, and see what their thoughts are about the school, what they really like about the school. Maybe they can give you some helpful tips that way as well. Also, reference DT Bootcamp's YouTube channel. We have a ton of resources for the entire application process, so make sure you're subscribed. Also, you want to post any questions that you have about the interviews in the Dental School Interview Bootcamp Facebook page. We have a ton of dental students in that group, so they can really give you some valuable feedback on anything that you're asking for, really. Tell me about your shadowing experience. This is the next question that came up quite a bit in my interviews. And how I would answer this is, firstly, I would say it was an integral part of my decision process to pursue dentistry. And I'm assuming that's probably true for you as well. This was probably your first real-world experience with dentistry, although you may have done some research by yourself and maybe saw a few YouTube videos about what being a dentist means. This is where you really get that real-world experience. Additionally, you want to think about what you learned and what you enjoyed about your shadowing experience. Maybe you learned some procedures, maybe you got familiar with some of the tools and equipment, maybe you really like the manual dexterity component of dentistry or that patient interaction. However, do keep in mind that if you do mention that you became more familiar with some procedures or you became more familiar with some of the equipment, they can follow up and ask you, so what kind of procedures did you get familiar with, or what kind of equipment are you familiar with? And so it is sort of important to understand a few basic procedures. As I've heard from time to time, some students were asked about how would you go about doing a filling, or how would you go about doing a root canal? And it's sort of important to understand the basic, procedure of how you would do that. And so I demonstrate that on the next slide. So the first common procedure we're going to be going over today is the root canal. So a root canal is an untreated deep cavity which results in infection of the blood and nerve supply of the tooth. So the treatment that I would the treatment procedure that I would follow is I have 8 steps. So the first step being apply numbing gel and anesthetic. Next, you're going to use a burr to remove the decay. So we have the decay tooth right here. We're going to use a burr to remove that. We're going to use files to remove any additional decay from each individual canal. And you probably remember these files, those small things, and then you sort of have to do a rubbing motion between your index finger and your thumb to remove any additional decay. You can use rotary instruments for further cleaning if needed. Afterwards, you're going to fill the canals with gutta percha. And you remember these plastic-looking tubes that you sort of put in each individual canal. If the tooth is sort of weak and it needs additional sort of structural support, you can attach a post. You can add filling material from there and pack it down with a condenser. Use a curing light and suggest a crown. So that's pretty much the basics of how you would go about doing a root canal. Obviously, you don't need to know any sort of really special cases or anything along those lines, but the basic outlines you should be somewhat familiar in. Next is the filling. This is probably the most common procedure that you saw. So a filling is used to reduce bacteria and extend the life of the tooth. Treatment goes as following. You're going to apply the numbing gel and the anesthetic. Remember, you're going to be sort of injecting the anesthetic just above or just below the tooth and the gum line, and you're going to wait till you get a palish color. That's how you know it's working. Afterwards, you're going to use a burr to remove any decay, some etch adhesive to make a rough surface. You're going to dry the area and use a curing light. Afterwards, you're going to add the composite filling and pack it down with a condenser. Obviously, if you're using amalgam, it's slightly different. Use a curing light and check the bite. So over here we have the silver filling. This is also known as the amalgam. And over here you have the composite filling, also known as white fillings in this diagram. And I'm going to sort of let you do your own research as to what the differences are between the two. Next question, tell me about yourself. So what you want to do for this question is you want to stay relevant. And usually the interviewer is interested in hearing the last few years before you were applying to dental school. Remember, you want to stay relevant to your decision to attend dental school. Don't start talking about just some irrelevant background information that the interviewer can't really go about. Remember, you're trying to encourage a dialogue, and how you answer this question can sort of lead the interview. So if you want to talk more about sports, maybe you want to focus about sports in this discussion here, or with this question. And so you can include some background information, but remember, you want to insert it sort of strategically. And so I'm just going to read you my answer. It's in 3 parts, and we'll sort of go over it part by part. So initially, I said, well, I was originally born in Ukraine, but I moved to Toronto, Canada at a young age. Growing up in such a multicultural city as Toronto allowed me to build relationships with people who came from all over the world. I got to experience many different cultures and learn about different ways of life. So this tells the interviewer a few things. One, I'm from Canada, so that's kind of unique. Maybe they want to talk more about Canada. But mainly, it talks about my ability to sort of form relationships with a very diverse, population. Right? If you're a dentist, you're probably going to have a very diverse patient base, and that's sort of an important skill to have, relationship building. So that was sort of implied in this paragraph. So as you can see, I inserted that pretty strategically. Afterwards, I went on to saying, this year I'm finishing up my studies at York University, where I'm majoring in kinesiology. The reason I chose to pursue kinesiology from the traditional biology or biomedical sciences route is because of my involvement in sports. I've played many sports throughout my life, and I felt kinesiology would allow me to link my classroom knowledge to my passion for sports. And so in this paragraph, I can invite the interviewer to ask me more about my undergrad. I can ask them, and especially invite them to ask me about my multiple sports experiences that I had listed on my application. And then I finished off my answer with, during my undergraduate years, I managed to balance my university work with my many part-time job ventures. My hard work and dedication has gotten me multiple academic scholarships, while at the same time I was able to fully finance my education so I can eventually pursue my dream career of becoming a dentist. And so what I did in this last section of my answers, I sort of told them that I have great prioritization and time management skills, very important skill set to have in dental school. And so as you can see, that's sort of the framework that I followed. And maybe you want to sort of follow a similar framework when you're giving your answer. Moving on, what accomplishment are you most proud of? So this appeared in a few of my interviews. So nonetheless, I'm going to give you a few tips. What you want to do is maybe try to steer away from academics unless you have something really outstanding that no one else has. Simply because if you have strong academics and you're interviewing, so does everybody else, right? So you're not really standing out in that way. What I can tell you is maybe you want to talk about your sports accomplishments, if you're involved in any athletics, if you want any sports competitions, something along those lines. If you started a club, or maybe you started a company, that's really cool. If you led any initiatives, that's pretty awesome to talk about. Also, don't undermine your accomplishments. Say it the way it is. Try to present yourself in the best way possible. Tell me something you regret. So another way to sort of phrase this question is tell me something that you would do differently. And you want to keep this professional. So don't start talking about you regret dating this person or you regret the McDonald's you had for lunch the previous day. That's not what they're looking for. So keep it professional and talk about what did you learn from this experience, what you gained, something along those lines. And you always want to end on a positive note. So whenever, and this goes in general for whenever you have somewhat of a negative question, what I mean by that is like questions such as, what are your weaknesses? Tell me something that you read. You always want to end on a positive note of what you gained from this experience. That's how it go about things. And so here's a sample reply that I could have used when I was given this question during my interviews. I don't have many regrets because I use my experiences as lessons to guide me in the future. However, something I would do a little differently is focus on my public speaking skills. While I was an undergrad, I majored in science, and while my knowledge of basic sciences was integral towards paving the path to dental school, I wish I had taken a few more classes that involved presentations. Nonetheless, I'm currently enrolled in my humanities course, which has several group presentations and will help me with public speaking. And so as you can see, I sort of phrased my answer where it's not something very negative. However, I did tell them that I'm trying to expand on a certain skill set, which is great. Dental schools are looking for individuals who are constantly trying to improve, expand their skill set, and that's great. Additionally, most people go the sciences route. If you want to go to dental school, you're probably going to be involved in biology, chemistry, something along those lines. So this is why this example is great. A lot of those sort of majors, they don't have a lot of presentation components, and that's sort of understood. And so by saying something like this, it makes you seem like you're really trying to put yourself out there and challenge yourself, which is sort of awesome. If not dentistry, what else? So what I can recommend here is consider careers, or I'm sure that you probably considered other careers along your path. So when you're answering this question, consider careers that have many similarities to dentistry. So for example, if you're going to tell me, if I was a dentist, I'll be a shrimp boat captain, like we have Forrest Gump over here. I can't really follow the logic over there of how those two sort of connect. So what I can tell you is perhaps you want to think about careers that involve interaction, human interaction, careers that are helping others. Careers within healthcare are great, especially those leadership positions, because as a dentist, you are a leader of a team. Many manual dexterity or careers that involve manual dexterity. And so my answer for this was I could see myself being a physician, more specifically a general surgeon. And I feel there's a lot of intersections between those two career fields, and it's sort of a logical sort of decision process or something to follow. Okay, so there's manual dexterity, there's a patient interaction, you're helping someone, it's within healthcare, so it sort of makes sense, if you will. Moving on to the ethics in healthcare. So after this slide, it's going to get a little bit interactive. Now, I know this is the YouTube version of this presentation, and so I'm just going to encourage you to pause the YouTube video in certain sections of the presentation. Anyways, let's just go through the basic principles of ethics. And I highly recommend that you sort of dig deeper into ethics and sort of really get a better understanding of ethics on your own time. So firstly, the main principle that I want to go over are these 5. So firstly, we have autonomy. So what does this refer to? So this refers to a patient having a say in their treatment, right? Patients have the right to refuse care. Back in the day, doctors would sort of just do a treatment plan and they wouldn't really get the patient's insight. They'll just go about things and just do it however they want. Another aspect of autonomy is also determining the capacity to make informed decisions. So as a healthcare provider, you're going to have to be able to determine capacity of your patients. So some people who may not have the capacity to make informed decisions are going to be people such as, or people with neurodegenerative disorders, so such as Alzheimer's or dementia, psychiatric disorders, even people who are under the age of 18, right? So oftentimes children, they're required to have sort of a parent or a guardian approve of treatment or something along those lines. They have to sign off on them. So that's something that you want to keep in mind. The next principle of ethics is beneficence. So this is known as doing good. So as a healthcare provider, it is your duty to do good. You need to do everything to sort of help the patient. Then there's non-maleficence, and this means do no harm. So as this goes, I guess this goes hand in hand with beneficence, because you can't do any harm to your patients or avoid it at all costs. Justice. So what this means is that decisions should be made blindly. So what I mean by this is that as a healthcare provider, you shouldn't be making your decisions based on your patient's ability to pay, what their race is, what their sex is, what their age is. So essentially, decisions should be made blind. And also you have to factor in resources, right? So we only have a limited amount of resources, and that's something that you want to keep in mind as you're making your decisions. And lastly, I want to mention this thing called the emancipated minor. This showed up at a couple interviews that I heard from other people, and so it's kind of a tricky one, and so that's why I wanted to include it. So what this does is it refers to an individual or individuals who are younger than 18 who are treated as adults and have the ability to make their own decisions. So if they're under 18, usually we require the parent or guardian to sort of approve of things, versus here they have the ability to or they have the capacity to make informed decisions. So that's what you want to keep in mind. So they must meet certain criteria, so they have to have financial stability, they have to be living alone, and laws vary between states. And usually an emancipated minor situation appears whenever you have someone who's roughly the ages of like 15 to 17, somewhere in that range. So that's something to keep in mind. If you're ever given an ethical scenario and they say the patient is 15 or 16 or 17, maybe you want to think about an emancipated minor. So from here, I'm going to take the following scenario. I'm going to read the scenario, And then afterwards, I want you to pause the video and sort of think about like, what would you do? What ethical principles apply in this scenario? And then afterwards, you can unpause and see and hear my thoughts on it. So there's no true question to this one. So I want to clarify something here as well. So you are a physician and this is in the emergency room. So you have to put yourself in that position. So a 10-year-old child has a traumatic injury and has lost a significant amount of blood. In order to save his life, a blood transfusion is needed. So my questions to you are, what would you do? And what ethical principles apply in this situation? And so I encourage you to sort of pause the video right now, take a few minutes, think about it, and then see what my comments are, and then you can make your decision from there. Anyways, moving on. So what ethical principles apply here? Well, one ethical principle I could definitely say is beneficence. It's your duty as a physician to do good, and you want to save this person's life. Another principle that applies here is patient autonomy, right? This is a 10-year-old child, and since it's a traumatic injury, he's probably unconscious. So they don't really have patient autonomy here. They don't have autonomy here. They can't really make a decision. So that's something that you may want to consider. However, nonetheless, what I would do in this situation is I would proceed with the blood transfusion. I would save the person's life. There's that. Now, I'm going to take the exact same scenario and I'm going to add one more sentence to it. We're going to change it up a little bit. So a 10-year-old child has a traumatic injury and has lost a significant amount of blood. In order to save his life, a blood transfusion is needed. However, the children's parents are Jehovah's Witnesses and refuse to give permission for a blood transfusion. So what ethical dilemmas are involved in this situation, and what would you do now? So I encourage you to now pause the video, think about it for a minute, and then unpause the video later on. So what I could say here is, so the same principles apply as we previously mentioned. So beneficence, it is your duty to do good. So you want to do everything to try and save the patient's life. Also, there's that principle of patient autonomy, right? The child doesn't really have the capacity or the ability to make decisions. He's probably unconscious at this point, so he doesn't have the ability to make a decision. However, his parents are refusing treatment. However, on the other hand, I could also argue the point of the child sort of brain is like not really developing. Has he been given the right opportunity to sort of make a decision whether he wants to proceed with this religion or not? So that's something that you also want to maybe take into consideration. And what about the justice aspect of it? Right? When you're making decisions, you shouldn't be factoring in like religion, age, sex, anything along those lines. And so what I would do in this situation is I would actually proceed with the blood transfusion, even though the parents sort of refuse that. There are laws in place to actually protect the physicians in these types of situations where they don't have to sort of go through child protective services or something along those lines. And they can just go ahead with the blood transfusion. So there's that. So now let's move on to a third scenario. So let's take the following scenario. And this is probably a scenario that will that you may see when you're a dentist and you're practicing in your clinic. So the following scenario is as follows. So you're the dentist. So you explain the treatment plan to your patients. However, they don't understand what is being said. So you proceed to explain the treatment once more. And once again, they don't really comprehend it. And then you proceed to explain the treatment the third time. And the patient shrugs it off and says, sure. So do you see any issues here? Any ethical principles that are involved here? And how would you act in this scenario? So once again, I encourage you to pause the video right now. Think about how you would act in this scenario and then unpause the video to hear my thoughts. So I definitely see an issue of patient autonomy here. They're not able to make an informed decision. So they didn't understand the treatment plan after I mentioned it 3 times, and then afterwards they just shrugged it off and say sure. So perhaps there might be, if it's an elderly patient, this can definitely be a case of Alzheimer's or dementia. So they don't really have the capacity to make an informed decision. So in this scenario, I may try to explain things a little differently to the patient. Maybe I'll get some diagrams. If that doesn't work, then obviously I cannot proceed with the treatment unless they fully comprehend it, or if I get some of their, like a family member to intervene and approve of the treatment. That's how I would go about things. But I would definitely not proceed with the treatment as the scenario stands. Now, moving on to MMI questions or MMI style interviews. So MMI questions are very broad in nature. They can ask you an ethical scenario. They can ask you just some other scenario. They can maybe give you just a statement and ask you what your thoughts are on that statement. However, with practice, you will become better. So how they work is usually you're going to be given a prompt, and this is just a paragraph. It's going to outline a scenario or a question, something along those lines. And you're given a minute to sort of think about a response, how you would answer that question. From there, they're going to invite you to sort of walk into the interview room or sit down at the desk. And From there, you want to say hello, shake hands, and what I recommend you do after this is say, let me recap the scenario to ensure that I understand it. So what this does is that, firstly, it ensures that you fully understand the scenario, because there could be some aspects of it that you misunderstood. And it's also okay to ask for clarification. I remember during one of my MMI interviews, the scenario that I was presented was so convoluted that I could understand only half of it, and the other half I didn't really understand it. And then my interviewer just sort of walked me through the process, and I was able to answer it adequately. And also by saying, let me recap the scenario to ensure I understand it, you sort of have additional time to think and organize your thoughts and perhaps think of a better answer. So let's take the following MMI scenario. You are a family physician seeing Jane, a 67-year-old woman with a recent history of multiple fragility fractures. You diagnose her with osteoporosis and prescribe some biphosphate drugs and other pharmacological treatments. Jane tells you that she has heard some good things over the internet about alternative medicine treatments such as Chinese medicine, and she is adamant on trying these as well. You are concerned about the use of these alternative medicine treatments and the possible negative effects they could have on Jane's health. How would you act in this situation? So, once again, I encourage you to pause the video, sort of think about the situation, read it over a few times, and tell me, how would you act in this situation? So this is what I would do. Well, first, I would ensure that Jane understands the difference between Western medicine and Eastern medicine. Remember, Western medicine is evidence-based medicine. It goes through clinical trials. It has like double-blind studies to ensure its efficacy, whereas Eastern medicine does not. And other words for Eastern medicine or other synonyms are Eastern medicine, Chinese medicine, or alternative medicine. Those terms are all used interchangeably. However, at the same time, I would ask Jane to sort of run any Eastern medicine treatments by me to ensure that they don't interfere with her treatment. For example, some Eastern medicine techniques may be just some sort of a massage or something along those lines. And those will probably not interfere with the treatment that I prescribe for her. And so I'll be okay with that. If my patient can sort of have a better outlook on life, have a better psychiatric outlook, they're going to make them feel better, I think that's perfectly fine with me. I don't really have any problems with that. So Eastern medicine can have some positive effects on Jane. As long as she's transparent, I don't have any issues with it. So that's how I would act. So some resources or some additional resources I could tell you to sort of improve your interview skills are definitely join that Dental School Interview Bootcamp Facebook group. Look into SDN Dental School Admissions Guide, right? That's a great guide. It has a lot of the current stats. It has the entire interview process, some common questions, things like that. We have some MMI scenarios here for you to practice with. We have an ethics sort of a website that you can reference to learn a little bit more about ethics. And be sure to check out the YouTube page. If you haven't subscribed, be sure to subscribe to us. We have a ton of informative videos about the entire application process, as I mentioned. And by the way, all these resources will be in the description box below for you to reference in the future. So wrapping up, so skills come with practice, right? Utilize the resources that we share on our social media platforms. Also, if you're looking for any additional tips, post on Dental School Interview Bootcamp Facebook page. We'll definitely read those. We have a lot of moderators there. We have a lot of dental students there. And so they'll definitely be able to help you out and steer you in the right direction. So thank you very much for listening to this presentation from DAT Bootcamp. I hope you have a wonderful day.